privilege limits access to health care. The state enhances the economic vulnerability of those on the social and political outside while increasing the security of those on the inside. A particularly good example, state-secured privilege makes it hard for people to get access to decent, affordable health care. The degree to which health care services are accessible is determined by structural, political factors. It's very often a function of the way the politically well-connected make use of their access to state power. Drug companies and medical device manufacturers reap monopoly profits because the law gives them patent rights. Patents don't make economic sense, despite what their corporate apologists might tell you. But they do ratchet up the profits of those who own them, at the expense of ordinary people. Working hand in hand with healthcare professionals groups, state and national laws impose licensing requirements that limit who can provide healthcare services. By constraining the numbers of people who practice various health professions and the kinds of services particular professionals can perform, these requirements boost the incomes of health professionals and artificially inflate the prices of their services. Hospital licensing and accreditation requirements similarly limit the number of hospitals in operation, and therefore pad the pockets of existing hospitals while driving up the prices people have to pay for hospital stays and legal services. Legal limitations on advertising in the area of healthcare services also make it easier for healthcare professionals to maintain high incomes. Rules that permit purely punitive damage awards in medical practice cases increase unpredictability for healthcare providers and encourage the practice of defensive medicine, with predictable results for healthcare costs. The FDA approval process adds to drug costs and lengthens the time that elapses before many a drug becomes available, in ways that certainly aren't always to the benefit of healthcare consumers. So do other legal constraints on production and sale of drugs. Rules that provide tax incentives for firms to purchase health insurance for workers tend to make it easier for insurance companies to charge higher prices than they likely would be able to charge to individual consumers. Current rules that preclude the purchase of insurance across state lines also make it easier for insurance companies to charge high premiums and reap handsome profits. Rules that limit who can be an insurer in the first place can have a similar effect. A physician who wanted to offer patients care on a flat fee per year basis was recently prevented from doing so because this arrangement looked too much like insurance, and the physician wasn't a licensed insurer. Who benefited? Not the patients, clearly, but the insurance industry. Agricultural subsidies also contribute to healthcare costs by encouraging the purchase of lots of low-nutrition foods. Purchasing these items simultaneously redirects resources that could have been used to buy foods that made positive contributions to people's health away from the purchase of such foods, and encourages the purchase of items that may actually decrease health and thus boost healthcare costs. These kinds of legal privileges are sold to the public, of course, as designed in various ways to help ordinary people. But their practical and, in many cases, intended effect is to take money away from ordinary healthcare consumers and transfer it to people and organizations with more political privileges. State action also limits access to healthcare by driving down the incomes of people who might want access to healthcare or other goods, but can't afford them. The state's promotion of poverty in all the ways I've previously outlined makes the impact on economically vulnerable people of state-secured privilege even more severe than it would otherwise be. Too many participants in the recent American discussion about healthcare share the assumption that privileged, well-connected political actors can and should keep their privileges. The options that have received the most attention in the recent healthcare debates are options that largely treat privileges enjoyed by the politically connected and legal burdens on the economically vulnerable as unproblematic. But the best way to ensure access to healthcare is to redistribute wealth from those who benefit from special privileges to ordinary people by eliminating unjust rules that allow the wealthy and politically favored to reap monopoly profits and that make and keep poor people poor. Poverty, hierarchy, or anarchy. The state can't effectively provide macro-level management of the economy. And when it gets involved in the operation of industries and firms and the economic behavior of people and families, it predictably shores up the wealth and power of the already wealthy and powerful. It creates monopolies that insulate the companies owned by members of the elite from pressure exerted by other firms. It forces ordinary people to subsidize them at every turn. It imposes burdens and erects barriers that make and keep people poor. And when people can work, they often find themselves working in organizations that can afford to maintain centralized hierarchical structures because of the monopolistic positions they enjoy because of the state's action and the subsidies the state provides them. The fact that the state serves the interests of the elite while frequently disregarding or undermining the well-being of workers and the poor is not an accident. As long as there is a state, it will be vulnerable to lobbying and manipulation, and the wealthy will be best equipped to lobby and manipulate. Further, even if state officials could somehow be rendered invulnerable to lobbying and bribery, the state officials themselves still could, and doubtless often would, take full advantage of their power to enrich themselves at the expense of others. Even if the existing ruling class were somehow eliminated, state officials could and likely would turn themselves into a new ruling class. The problem, I emphasize, is not per se with particular people. The problem is with the vast power the state exercises, its power to cartelize and regulate and subsidize and demand tribute and compel compliance through fear. The capacity to exercise that kind of power is what creates opportunities for mischief and temptations for people to exploit and dominate others and benefit their political cronies. I'm not saying everyone does or will do this, but with this much power at their disposal, some people almost certainly will, with deplorable results. People organizing their economic lives freely and peacefully can certainly make mistakes, but they won't be able readily to shift the costs of their mistakes to others. And without a state apparatus to magnify the consequences of their choices dramatically by extending their power, people who make bad choices in a stateless society won't be able to do nearly as much harm as state actors. There's good reason to think that a stateless society would be freer, more efficient, less hierarchical, less impoverished than a society overseen by a state. That's reason enough for me to be an anarchist.